My name is Andrew Nemecek. I am a neurosurgeon at Rebound Neurosurgery. I focus primarily on spine surgery and reconstructive spine surgery. I also do cranial surgery and trauma and general neurosurgery as well. I grew up in Ohio, in southern Ohio, and then in northern Ohio. In Cincinnati is where I was born, and Cleveland was where I was raised. Hobbies as a child, I played a lot of sports. I rode my bicycle a lot. One little known fact about me is I was at one point in time the number one or number two ranked racquetball player for my age in the state of Ohio in the late 1970s and early 1980s. I spend a lot of time on two wheels on my bicycle. I ride a road bike, I ride a bike in the gravel, I do a lot of mountain biking. For the last several years, I've spent a lot of time chasing my youngest son around the mountains of the Pacific Northwest, trying to catch up to him on our mountain bikes. I still have not been able to catch him yet. Someday. I went to the University of Cincinnati for undergraduate education. I was involved in the student government there. I was student body vice president and served on the board of trustees, as well as a number of other organizations. I graduated in 1990. I went to medical school at Case Western Reserve University in Cleveland, Ohio. I graduated from there in 1998 with a degree in distinction in neurosciences and honors in Alpha Omega Alpha. I did residency and some graduate school training at the University of Washington from 1998 until 2005. During that time, I was enrolled in the Masters in Epidemiology program in the Department of Epidemiology and Biostatistics at the University of Washington as well. And I used that education as part of my research when I was doing research. So why neurosurgery for me really? It was a process really. I realized in medical school that I wanted to be a physician that takes care of patients as opposed to one who reviews films or laboratories or things along those lines. And I realized pretty quickly that the surgical approach towards patient care was more suited to my personality than, say, an internal medicine doctor or a family medicine doctor or a primary care physician. As far as the neuroscience aspect of things, I'd always been very interested in neuroscience, in the brain and the mind, as well as the spine. So that the combining of the two is really sort of a natural fit for me. I think what makes Rebound unique is the fact that we offer care in a wide range of specialties and disciplines with a wide range of practitioners of varying backgrounds, education, training, etc. People come to see me, for example, for back issues or neck issues, and many times have an underlying hip or a shoulder issue that's really the primary problem. And with Rebound, we can make that assessment, evaluate them, and get them directed towards the appropriate place right away. Many times people have multiple problems. The body is really one complete body, not separate systems there. And at Rebound, we're able to offer and be able to provide care for people across disciplines. So that's probably the one thing that really sets us apart from other groups in the area. There's a culture in Rebound of providing good care for patients, for listening to patients, for being a resource for patients. We are really the only neurosurgeons in the area. From Olympia down to Portland, Rebound are really the only neurosurgeons available around here. And so we have a responsibility to the community. And as community neurosurgeons, I think we take that responsibility very seriously and bring that message out to our patients and embrace that culture of providing care. There are so many stories I can think of over the years in terms of taking care of patients that have left their mark on me. Here at Rebound in Vancouver, we've had some amazing successes. I can recall patients that came in paralyzed from car accident, for example, dislocated their neck, and my partner and I were able to relocate the neck, get their fracture fixed, and literally they walked out of the hospital a month later. Whereas usually when someone has a paralysis or a spinal cord injury that's complete like that, the chance of recovery is approaching zero.